All right, so you've made it. You're finally in the clinic. This is it. This is where all that textbook knowledge starts to become real. And I know it's super exciting, but let's be honest, it can also be pretty intimidating. You're standing there with your first patient, and suddenly there's just a lot of information coming at you.
Feeling a little, or a lot, overwhelmed? Yeah, that's completely normal. All of a sudden you're juggling patient histories, what you're seeing in their mouth, x-rays. It really can feel like you're trying to drink from a fire hose. But here's the secret. The key isn't to memorize everything. It's to develop a system for thinking. And that's exactly what we're going to do today.
You know, this is a classic moment for every single new dental student. You spot a little dark spot on a tooth, and your brain just goes into overdrive, right? Is it a cavity? Do I need to drill? What do I do next? And then your instructor just calmly leans over, takes a look, and says, oh, that's just a stained fissure. No treatment needed. The skill you're really building right now is learning how to tell the difference, what's important and what's just noise.
So to start telling that difference, we have to get our language right. Every single piece of information you collect, every little detail, it's going to fall into one of two main buckets, signs and symptoms. Understanding this difference is like step one in making sense of that wave of information.
But let's back up even one more step. The umbrella term for everything you collect is a finding. Think of findings as all the individual Lego bricks. A finding is just a neutral piece of data. It could be a blood pressure reading, something the patient says, or something you notice during your exam. It's just the raw material you'll use to build your diagnosis.
Now those findings, those Lego bricks, they get sorted into two piles. Signs are objective. They're what you, the dentist, discover. Think of yourself as a detective looking for clues. You might see swollen ankles. Symptoms, on the other hand, are subjective. They're what the patient tells you. They reveal things like tooth pain. So, to put it simply, you find the signs, the patient tells you their symptoms. Okay, so you're gathering your signs and symptoms. Now what do you do with them all? To keep from getting totally lost in the weeds, you need a protocol, a consistent framework you can use every single time with every single patient.
And here it is. It's a simple three-step path. Step 1, discover the finding. That's your data collection. Step 2, and listen, this is the most critical part, you evaluate for significance. Is that dark spot just a stain, or is it actual decay? This is where you start using your clinical judgment, and only after you've decided a finding is significant do you move on to step 3, you form a diagnosis. Now, as you start getting the hang of this, you're going to face a new temptation. You'll want to jump ahead. A patient will ask you something directly, and you'll want to give them an answer right away. And that brings us to a golden rule that you absolutely cannot break. I want you to let this quote really sink in. This isn't just my advice, it's a fundamental principle. The desire to reassure your patient is a good thing, but making promises based on incomplete information, that can lead to huge mistakes, and honestly, a massive loss of trust.
Let me tell you a quick story every dentist has a version of. A patient points to a tooth that's been bothering them and asks, "Doc, can you save it?" And you, wanting to be helpful, might say, "Of course we can save it." And then you take the x-ray, and it shows a massive problem, and you realize extraction is the only real option. Now you have to walk back into that room and take back your promise. Trust me, it's an awful, embarrassing conversation you can completely avoid.
So how do we dodge that bullet? It's simple. You systematically build a complete patient database before you even think about treatment recommendations. This database is the foundation, and if the foundation is shaky, the whole plan is going to come crashing down.
And that foundation is built on 4 crucial pillars. Not 3, not 5, 4. And getting all of them right is non-negotiable.
Here they are. The patient history tells you the story, the why they're here. Your clinical examination is what you see, your direct observation. Radiographs, of course, show you everything that's hiding under the surface. And finally, other diagnostic aids, like tests, fill in any last pieces of the puzzle. You need all 4 of these to confidently and correctly build your plan.
So look, here's the main takeaway. Your journey to becoming a great clinician really starts right here by mastering this process. It's not about having all the answers on day 1. It's about having a system to find the answers. Be systematic, be thorough, and never, ever lose your curiosity. That's what's going to make all the difference.
Hey, if you found this framework helpful, make sure you follow Dr. Sarang Suresh for more practical insights to help you on your clinical journey. Keep up the great work, and remember, stay systematic.